has a clear plastic sleeve that protects the catheter from contamination. To use a sleeved suction catheter, start by cleaning your hands with soap and water or alcohol-based hand gel. Clean your work surface with soap and water or a disinfecting wipe. Gather the equipment and supplies you need: a sleeved suction catheter kit, non-sterile gloves, sterile water, and an assembled suction machine. Check to make sure the suction machine and supplies are correctly assembled. Put on the non-sterile gloves. Open the sleeved suction catheter kit. Pick up the sterile water basin, open it without touching the inside, and carefully set it on your work surface. Pour sterile water into the basin. Turn the suction machine on and check for recommended suction pressure. Tear off the perforated top of the suction catheter sleeve if necessary. Connect the catheter to the suction tubing. Carefully advance the catheter out of the sleeve to your patient's pre-measured suction depth. Hold the sleeve and catheter at this depth. Do not touch the exposed portion of the catheter or let it touch anything else. Insert the tip of the suction catheter into the hub of the trach tube. Continue to advance the catheter to your patient's pre-measured suction depth. Block the thumb port on the suction catheter with your thumb. This creates suction pressure within the catheter. Roll the catheter between your thumb and index finger as you slowly pull the catheter out of the trach tube. Occasionally lift your thumb off the thumb port. This releases the suction pressure. Insert the tip of the catheter into the sterile water basin. Block the thumb port and suction water through the catheter. Check if your patient needs more suctioning and repeat the suctioning steps if needed. The number of times you suction depends on your clinical assessment of the patient and the individual care plan. Rinse the catheter and tubing after each suction procedure. When you finish suctioning your patient and rinsing the tubing, turn the suction machine off. If you plan to use the catheter for additional non-sterile suctioning, pull the sleeve over the catheter. The patient's care plan identifies appropriate reuse of a catheter. If you do not plan to reuse the catheter, put it and your gloves into the trash and clean your hands.